Why is it so important to get a diagnosis for something such as dementia? I'm Mark Schmidt with Home Care Assistants of Tucson and Tucson Dementia Dialogues. To help answer that question today, I have Nicole Smith, the author of Diagnosis Dementia, Your Guide to Elder Care Planning and Crisis Management. Nicole, welcome.
Thanks, happy to be here.
What inspired you to write a book, as comprehensive as this, about dementia?
Well, I wrote the book out of personal experience. So within about a time frame of a year, my mother, my stepmother, and my father were all diagnosed with different forms of dementia. And I had to learn everything legally, medically, financially, emotionally, how to deal with all that. And I couldn't find a book that I found comprehensive enough to cover all those things that I was confronting as I was flying around the country to manage all of this. And so I wrote one and I curated resources as I found them, whether it was books or blog posts or websites or movies. And I captured all that into this book to hopefully help other people going through this.
So what you're saying is, not only did you have multiple people in your family, but you were dealing with multiple different types of dementia, and you were dealing in multiple states, all at the same time, pretty much?
Correct.
Navigating multiple states, situations, bureaucracies, medical systems, and you had to find some common grounds to start. I mean, I don't know how else you could do that, is to find some common ground to say, here, let me plant my flagpole here and start here and try and navigate from there. And how long the process? I mean, I know that you said over a year, in the process of about a year, having these different diagnoses coming in, but how long did the process take of putting this together and the writing of this book?
I started writing as a way to process all of my feelings and different emotions and during plane flights. And I just started capturing my thoughts as well as the resources that I found helpful, because there's a lot of fluff out there. There's a lot of information out there. I call it the Wild West of dementia care and elder care, because everybody's trying to come up with the latest thing and the gadget and all kinds of ways to help people, and some are helpful. I found some helpful and I found some not so helpful, and so I wanted to capture those, and I just felt compelled to create this resource. And it all started a couple years before I started writing, and then when I realized I kind of had enough content for a book and that it might be needed. And so then I just kept writing. I hired a professional editor, a professional book designer, a professional cover designer, and soup to nuts, it probably took a year and a half to get it.
Fantastic. Nicole, in your book, you talk about the importance of getting a diagnosis for dementia. Can you expand on that a little bit? Why is it important? And how did you go about that process?
Sure, it can be important for different reasons. In our situation, we needed to get the diagnosis to take control of my mother's affairs, and that was a hard process. So she had already been diagnosed by the neurologist and diagnosed by the primary care physician, but they did not want to write letters to confirm that fact, so that because the trust required that there be letters written by the doctors to invoke the terms of the trust. And that took a long time. Sometimes it doesn't take so long, but that was our driving force, is to get those letters, get the diagnosis, to figure that out, to be able to sell her house and go on with all of that. Other people, I think, should seek a diagnosis, because dementia is not just memory loss. As you know, it could be behavioral, judgment, language, stories, getting lost. So there's a lot of different ways dementia can present, and everybody presents a little bit differently. And That's because there's different things that cause dementia. Everything is not Alzheimer's. There's so many kinds of dementia. So if you are able to have a physician diagnose what type of dementia you have, then you can take measures to treat that dementia and treat the portion of dementia you have. Because Lewy body treatment is different from Alzheimer's, and there is still no cure. There's still no definite diagnosis, but they are making headway in being able to diagnose through spinal fluid, through PET scans, through blood biomarkers. And the one thing we do know about dementia is that the earlier that it's detected, the earlier they can possibly treat and slow it down. Because once you pass a certain stage, it's kind of too late. And that's where we were with my mother. The other thing that you need to know is you need to plan, because it is a neurodegenerative progressive disease, and it's not going to get better. They can slow it down, but it's going to get worse. And the sooner you learn about that, accept that fact, get the treatment, and make a plan, then you're going to be able to manage caregiving, because it's so hard. And most people wait until they're into the mid to late stages because they're exhausted and they don't have any other option, and then they seek treatment or help or a plan, and then it's chaos. So that's why I put crisis management in my book, because most people just wait for a crisis.
Yeah, absolutely. So understanding the importance of needing that diagnosis, especially when you're dealing with different sub-healthcare systems, meaning different states and different systems, how did you go about getting those diagnoses? As well as, in general, how would you recommend as a starting point for people to follow?
One of the most important reasons to get a diagnosis is you want to rule out anything else. So it could be a UTI or a urinary tract infection. Sometimes that can cause people to behave kind of wonky. It could be a brain tumor, right? That's not good news, but it might be curable. So there's the one reason to get a diagnosis is to kind of get yourself checked out and rule out other things that could be causing some cognitive decline. And if that's the case, then move on. And once you rule those other things out, maybe it is dementia, and then you progress down that road.
Okay.
I would recommend talk to your physician, your primary care physician. But unfortunately, a lot of primary care physicians don't really know much about dementia, and they might just dismiss it as old age or aging or just normal memory loss, which may not be the case. So start with your primary physician, and if they're able to refer you to a neurologist or a geriatrician, then that could be your next step. But those are very hard to come by. Some people wait 6 months for that appointment. And if you're trying to get treatment and diagnosis early, that's a long time. So there's other ways that you can seek out help through a DO or there's new things coming down the pipeline with the guide model, which we can go into, where there's different providers out there that are able to diagnose. An ER doc, I think, has the power to diagnose you, but again, they're only seeing you for 5 seconds. So the other thing about going into the primary care physician's office is have a list of the things that your loved one's been doing that's weird, because that's what we call them, that's weird moments. And have a list of examples of what's been different about your loved one in the last 6 months, things that they've done that's out of character for them. So then you have evidence. Because the other thing we know is someone with dementia will rise to the occasion and seem perfectly fine to any other onlooker and hold it together and answer perfectly, and that's just another sign of the disease. But they're able to hold it together, and then they're dismissed, check, fine, your health is fine, move along. So you have to be prepared, and you have to be ready to confront that physician or that provider to say, no, I know my person, and this is not right, and what can you do for me? It's not the diagnose and adios.
Yes, it's like a whole different type and delivery model of advocacy. You know something is wrong, and at times you feel like you're being dismissed, and you have to, in order to advocate for the well-being of your loved one, you kind of have to stand your ground to say something is going on and I need to get that diagnosis.
Right, so you need to push, you need to have your research done, you have to be sneaky. So we went to the neurologist. First of all, I had to trick my mother into believing that she was getting a COVID booster. This was later on in the game. And then when she turned away after we checked in, I slipped an envelope to the receptionist, and this is commonplace. And then when we got into the doctor's office, I saw my letter opened in the corner of the desk that the doctor had kind of had a time chart. Like, I didn't give her 10 pages. I gave her a chart, very brief, very succinct, to be like, okay, this is what's going on. And so then she talked to me, she talked to my mom. The other important thing is to have an advocate, a conscientious objector, if you will, someone who can be there in the office and maybe sitting behind the patient to be like, no, yes, nodding, because if the physician knows a little bit about dementia, they'll know that this patient is going to do everything to preserve their independence, their composure, their cognitive rights, and so you've got to have that person in behind, kind of making statements or making gestures that kind of confirm or deny what's going on.
Absolutely. Once you started in that process of communicating to the physicians or the medical staff in this way, how receptive do you think that they were? Did you just have to make that eye contact and they were just like, got it, I'll get this information over to the doctor?
Well, no, they were receptive. The neurologist was receptive, and the primary care physician was receptive. But the roadblock we ran into is they weren't comfortable writing legal letters. I mean, it was just a letter on their letterhead confirming what they've already diagnosed, but that was our roadblock.
Yes.
And my aunt, who was a nurse, she was in the portal, she was talking to them, and she spoke their language, but it still took her 8 months to convince them. And this was in Los Angeles, so this was a giant health system. So we had the benefit of a really immense, wonderfully trained health system.
Yeah.
So not everybody has that. If you're living rural, back roads,
Yeah.
it's harder to get access to those types.
And even at times, even when you're in a rural community, it seems like the doctors at times can actually respond faster. However, it comes back to, do I want to write my letter with my name, saying it, and are there repercussions coming back to me as a physician? If someone wants to challenge my diagnosis, am I going to face legal repercussions?
Of course.
And so therefore, it's like pulling an arm and a leg to get a letter from many, not all, many medical staff.
Right. I mean, they already pay a boatload in malpractice insurance. They don't want to add this up. But the good thing is the conversation is changing. More people are understanding dementia. They're not afraid to talk about dementia. It's a community effort to kind of figure this out. And like I said, I think ER doctors are allowed to diagnose dementia. But again, you don't have the relationship. But most of us don't have the relationships with our physicians we used to have because we only get to see them for 3 minutes. But it takes, and like I said, I had a nurse advocate in my aunt, I had myself, I wasn't afraid to call and follow up and prepare the documents. It's a lot, and that's just the medical. But then you got the legal, then you got the financial, then you got the emotional, then you got the family dynamics. I had it all going on.
Yeah, sounds like it. And when you are looking at, well, particularly like, because I too have had family where we're going into the neurologist, and we had to say, we're not going to the neurologist, we're going for, because it's too much of the battle. It seems like at times, even at times that I ran into where the neurologists were like, we can do a cognitive test, but then there's now the short version, the middle-sized version, and the long version. And they're very quick to say, we no longer do the long version. That has to be done by a clinical behavioral psychologist who does the ultimate determination. But did you find that they were very open about giving the quick cognitive tests, or we can do this, but they didn't give much credence to it? Or how did you feel that they were on their receptive level on that?
The neurologist for my mother did give her the two-sided, draw a clock and identify these. We didn't get the words, I don't think, memorize these 3 words. But she did do that. And again, I think that's a tool. Like all these things are tools, but the most accurate in my view, in my experience, is the loved one, the daughter, the spouse, somebody who lives with them every day and is like, this is not normal for who they are and how they act.
Yes.
And that's the biggest red flag. And we had, in hindsight, there were signs leading up to my mom's cognitive decline, and I only saw her a couple times a year because we lived in opposite ends of the country. But I just called them "that's weird" moments. That's weird, and then just move on. And then later on, I realized, oh, if we would have been paying attention, but I didn't know anything about dementia at that time. Basically, I advocate for pursuing a diagnosis for several reasons. Because one, it's going to take some time to reach the specialist you want to reach if you're going to go that route. Also, if you're able to get the diagnosis and you want to start some treatment with some of these drugs or infusions that they have available now, starting earlier is better, and you're able to slow down the progress of the disease. Also, you need to get some plans in place. You need to get a power of attorney for healthcare, for financial. Mental might be too late, but having these legal documents in place is very important. And the sooner you meet with an attorney or figure out how to get those in place, the better, because as the disease progresses, that might not be so easy, and you're going to need those. And also, you're going to need to make a plan, because this is a progressive disease. It gets worse, it doesn't get better, and you need to plan on, where am I going to live? Who's going to take care of me? How are we going to pay for this? And those all take time. So the earlier you start to realize, accept the diagnosis, seek the diagnosis, and make a plan, then you're not going to be in the crisis mode, and you're going to have a little bit more of a sense of control on moving through this journey.
Nicole, thank you for joining us today.
Happy to be here.
And if you would like to have access to her wonderful book and guidebook here, it is available on Amazon. Anybody that has recently received a diagnosis for dementia with a loved one, I highly recommend that you take a look at this and get an access to this, because this could really help during this time of tumult in a loved one's life. Again, my name is Mark Schmidt. I'm with Home Care Assistance of Tucson and also with Tucson Dementia Dialogues. Please press the like button and subscribe to have further access to other topics relating to dementia, such as Alzheimer's, Lewy Body, or Parkinson's disease. Again, thank you for joining us, and we look forward to seeing you soon.